A lot of people mix up corns and calluses, but getting them confused can lead to the wrong treatments. Is there really a difference between them? Today, I'm breaking down how to tell the difference and what you should do for treatments. I'm Dr. Khosroabadi, a board-certified foot and ankle surgeon. Here on this channel, I educate you on foot and ankle conditions and treatments. Corns and calluses are essentially your body's defense mechanism. They develop in response to repeated friction and pressure as a way to protect underlying tissues. Corns are typically smaller, have a hard core, and usually form on the areas that bear the most pressure, like the tops and sides of your toes. Calluses, on the other hand, are larger, spread out, and usually appear on the soles of the feet, where the skin experiences continuous pressure. However, it's important not to confuse these with warts, completely different, which are caused by a viral infection. Corns and calluses are essentially the same condition, but they are named differently based on their location. Understanding the cause of corns and calluses is the key to preventing them. The primary culprit is friction and pressure. Why does this happen in the first place? Poorly fitting shoes. Shoes that are too tight typically form corns on either your big toe or your fifth digit. Wearing closed-toe high heels put pressure on certain parts of the foot, which also leads to calluses or maybe even corns. Loose shoes can also cause problems by allowing your foot to slide around, creating friction. A simple adjustment in what you wear can significantly reduce these problems. Let's talk about how your foot structure can cause the formation of corns and calluses. Abnormal foot mechanics. Foot conditions like hammer toes, bunions, or flat feet can alter the way weight is distributed across your foot. When the distribution is uneven, certain areas take on more pressure, leading to development of corns and calluses. Addressing these underlying issues is crucial for long-term relief. Now the important part, addressing foot deformities. Conditions like bunions, bunionettes, and hammer toes can lead to development of corns and calluses. By addressing these underlying issues, you can effectively alleviate the pain caused by corns and calluses. Prevention tips. Preventing corns and calluses is all about consistency and attention to detail. Here are some tips. Orthotics can be a highly effective way to help manage and prevent calluses. Custom-made orthotics are designed to address specific biomechanical issues in your feet, such as abnormal gait, dropped metatarsals, high arches, flat feet, and so on. By redistributing weight and providing better support, orthotics can reduce the pressure point that leads to the formation of calluses. Shoes should fit well, with enough space for your toes and your entire foot. Toe box has to be wide enough and deep enough for your toes, especially if you have hammer toes. You do not want any friction. I often see patients that have corns and calluses, and I look at their shoes, and their shoes are too tight and not wide enough and not deep enough. Conservative treatments like shoe modification and applying pads, applying creams, wearing orthotics can provide temporary relief from corns and calluses. However, in my opinion, the only way to achieve lasting pain relief is by addressing the underlying cause of these issues. This means if you have a hammer toe deformity that's causing corns and calluses, you need to get that fixed. If you have bunions and hammer toes, you need to get that addressed by surgery. This means that if you have bunions, bunionette, hammer toes, or any underlying foot conditions causing corns and calluses, surgery is the gold standard for achieving long-lasting relief. Another treatment for corns and calluses are shaving these areas. Shaving corns and calluses is a common procedure that involves carefully removing the thickened, hardened layers of skin that have built up in response to pressure or friction. This can provide temporary relief from pain and discomfort, making it easier to walk and wear shoes comfortably. However, it's important to note that while shaving can alleviate symptoms, it doesn't address the underlying cause of the corns and calluses. Thanks for watching. Don't forget to subscribe and hit that notification bell and give this video a like. Your support means a lot to us and helps us grow this channel. Until next time, stay awesome, and I'll see you in the next video.